people meet with me this way by televideo, and we have them fill out a brief form and we start the dialogue. I make sure they're optimized, as you said in this example. They're already doing all their work they can do. They're doing their own rehabilitation, the right strengthening, core work. They're feeding their muscles the right protein, the right macros, the supplements, the all the stretching, everything. But they're still having a problem. We first and foremost, we have to pin down the source of the problem, and usually the problem is pain. And we look usually at an MRI scan for if it's a joint or the spine, like in your example. And the MRI has to be a high quality MRI, not a cheap one. So it's this is called a 3 Tesla MRI. 3 Tesla is typically the highest quality signal to noise ratio. So if you were going to buy a new LCD screen for your home, you would go to the store. You'd say, "Hey, what's the best one?" I say, "Oh, it's the 4K Ultra HD." Okay, that's the resolution I want when I'm looking at a picture, right? So we want that kind of MRI for someone. We do it with what's called inversion recovery sequence, which is an add-on that helps us identify the changes surrounding the cartilage, whether it's a disc or whether it's a joint, another joint in the body. We want to see the changes in the bone cells adjacent to that cartilage. And then we do what doctors are trained to do. It's called clinical correlation, where we take the symptoms and the test results, this MRI, and we try to match it up and see if we can best explain where all this is coming from. Now, of course, at some point we need to lay our hands on the patient and examine and poke and prod, and that's always a requirement. But we can do most of it remotely now, and in many cases that helps us. So, for example, it might be, in this disc example, we might find a specific disc in the lower back. Let's say the lumbar 4 to 5 disc, and maybe all the other ones don't look so bad. In some cases, we see changes in all the discs, but only one is hurting. We don't want to go messing around with the other ones that aren't hurting just because they're starting to show some age. So we have to identify the source of the pain. And sometimes we do an injection to numb or block the suspicious area to see if we can get a temporary benefit. Put a little Novocaine or lidocaine in there, which is a numbing agent. And if the patient has a day or two of significant benefit in the pain, even though that's not a long-term cure, at least we say, aha, we've now confirmed practically what we see on the MRI is the source of your problem. And once we confirm that, then we can formulate options, including a regenerative approach to addressing that, hopefully without surgery, right? That's the goal.